So, good evening, everyone. All of you who are watching us and who may watch us later. Thank you for joining us today. We have our FB Live today as we try to do something every month. A very important reason and factor as to why we are doing the FB Live is because I truly believe that with the technology available today, information should be given and available to every person. We are not in the day and age where we missed out on something or some information, especially regarding our health, just because we were not aware of it. Awareness is the key factor for everything, because if we are not aware, we will not even know what needs to be done. So our intention really is not just to tell you about infertility, but also guide you as to what are the aspects that are affecting health and reproductive health, so that each one, irrespective of age, irrespective of whether they have subfertility or infertility, are aware of what are the factors that can affect health and reproduction at this point in time. So just to introduce myself again, I am Dr. Mamta Dighe. I am the director of Xenith Advanced Fertility Center. Our centers are located at two places. One is in Wakat and the other is at Korekau Park. We deal exclusively with infertility and IVF and have everything right from the basics to the most advanced technology and treatment available for IVF. So today, what we are planning to do is have a small talk and introduction on diabetes and infertility. Personally, I feel this is a very important topic. We've also tried to take this because, this is a week or a month related to nutrition. And we are also in the midst of a lot of festivals coming forth. Already, Ganpati Bappa has come, and I'm sure आपण सगळ्यांनी खूप मोदक खाल्लेत and पेढे खाल्लेत, लाडू खाल्लेत. So much stuff, and now we'll have Navratri and we will have Diwali, and it is a time of festivities and sweets and so many other things. But we also need to know that there are some things that come along with the sugar intake that we are taking, and how much does it influence our reproduction. Many times all of us know that diabetes will affect health, will affect the heart, may affect the kidneys, but we do not know what it might affect in terms of having a baby, and that is exactly what we are going to address today. So I hope that you go away with a lot of information and awareness on what is diabetes and how does it affect reproduction. So let us begin with what is diabetes. So diabetes is a metabolic disorder. Now, when we say metabolic disorder, what it means that anything that has got to do with our metabolism, that is how we utilize the food that we eat or the other energy intake in different forms, sugar, fats, proteins, etc., how they are broken down, and then how our body utilizes it for growth and for energy. So that is what metabolism is. Now, diabetes is a metabolic disorder. That means it is a problem or an issue that causes difficulties in the metabolism or the breakdown of the sugars or the carbohydrates that we consume in terms of our daily intake. So this is basically what diabetes is. So it does not either break down the sugar or does not help our body to utilize the sugar that we eat in the right manner. So what are the types of diabetes that we have? So there are basically two types of diabetes. One is type 1 diabetes and the second is type 2 diabetes. So type 1 diabetes is a condition where the pancreas does not produce the adequate amount of insulin that is required for the metabolism of glucose. And type 2 type 2 diabetes is a condition where usually what happens is that there is insulin resistance. So it means that your pancreas, the cells of Langerhans that we call that produce insulin, are producing insulin, but there is a problem at the level of utilization. So your cells are not able to use the insulin in the body, and therefore it cannot break down the sugar, and the sugar levels will start increasing. So these are the two main types of insulin, type 1 and type 2. There's also a third type that we call gestational diabetes. That is when a woman is pregnant, she can, when she has not been a diabetic woman earlier, during pregnancy, she can develop gestational diabetes. So that is the third type. But mainly what we are going to focus on is the type 1 and the type 2 diabetes that can affect reproduction. So when you are looking at type 1 diabetes, what is happening is there is no production of, or very less production of insulin. Therefore, the cells or the glucose does not have the insulin that can break down, and then the cells can utilize this. Now, this is usually it is said that it is caused because of a condition called autoimmunity. Now, what is autoimmunity? Basically, we have an immune system in our body. So what is our immune system? If there is any infection, anything that is not recognized as self, that is not me, that is not my body, this is not my cell, the body will launch an attack against those cells. So suppose if you have an infection, like maybe even COVID or viral or bacterial, the body will start producing cells and mast cells and antibodies and T cells, everything which will fight against the virus, the bacteria, or anything that is non-cell. In autoimmunity, what happens is that the body recognizes our own self or own cells as something other than non-self, and therefore they start launching an attack against our own cells, and due to this it will start destroying the cells. Sometimes it can affect a particular organ, like in diabetes it can affect the cells of Langerhans and therefore cause a decrease in the amount of insulin production, or various things like if you have thyroid, it can cause a problem with the thyroid cells. So this is mainly the reason why diabetes is there. Of course, there's heredity and so many other things which go hand in hand with the kind of type 1 diabetes. So here there is decreased production of insulin, and therefore the treatment requires insulin to be given to the person because there is no insulin to start with. Whereas in type 2 diabetes, the insulin is there, but the cell becomes resistant. So we call this condition something like insulin resistance. So therefore, what happens is if you can give certain medications which will help the cell to utilize the insulin, then such kind of a diabetes can be managed with oral medications which will help the cell to consume or utilize the insulin and then break down the glucose. So these are the two types, and this is the pathophysiology behind what happens. Now, basically, like I said, the causes mainly are heredity, autoimmunity, and sometimes there is, many times, especially in type 2 diabetes, there is a very low grade inflammation that is happening in your cells. So what happens in the cell walls with that low grade inflammation that is, it can start exposing your cell membranes, etc. And then usually the body is not, it can cause breaks in the cell membranes, and the body is not used to getting exposed to anything that has a break in the cell membranes, and therefore there can be an excessive inflammatory reaction and more, cells that are generated to kind of fight against some of these cells. So again, it kind of goes into autoimmunity. There are also a lot of other autoimmune factors that are associated with diabetes, such as thyroiditis and other issues. So whenever there is diabetes, there is also need to sometimes look at other autoimmune factors or illnesses which could be affecting. Of course, we know lifestyle is a very, very important factor. Stress, our eating patterns, obesity, everything is a major factor that can especially give an increase in the incidence of type 2 diabetes. So these are the two main factors. Now, what happens in diabetes is that its effect actually occurs on almost all cells in the body. So eventually, slowly, there will start being a low-grade inflammation of the cells and breakdown. And we know that diabetes affects the heart, the kidneys, the eyes, but the lesser known effects are on the reproductive system. It is also very worrying about its effects on the reproductive system, because we are seeing a trend that many people are getting affected with diabetes at a younger and younger age. So initially it was thought that especially type 2 diabetes will start after you end your reproductive age or your reproductive potential. So it's something that, we really would not worry of during our reproductive age. But what we are seeing is that a lot of younger individuals are getting affected and are developing diabetes much earlier, maybe because of the lifestyle, the diet, the obesity, the stress, whatever it is. And therefore, and we're also seeing that people are kind of, postponing the age of marriage, postponing the age of having children. And that is why when both these factors are being combined, we are seeing that diabetes has started affecting reproduction on a greater and greater level. Also, because most of us are aware about the effects of diabetes on other systems, we kind of take care about it, but we don't tend to understand that diabetes can affect our reproduction as well, or our capacity to have a baby as well. And therefore, most of the people kind of just miss out on it, that it's okay, maybe I have to exercise more and I have to take care of my heart more or my kidneys more, but they are not aware that, very insidiously, the diabetes is also affecting their reproductive potential. Now, the effect of diabetes happens on reproduction in both the females as well as the males. So let us first look at the effects of diabetes on females. So what happens is that type 1 diabetes usually occurs at a much earlier age. So many times, right since childhood, we will see there are children who are affected with type 1 diabetes. In such cases, what happens is that there is a very long exposure to the diabetes in these children and later on in the men and women who get into their reproductive age. Now, especially before the type 1 diabetes is even diagnosed or treated, there are these times when there is a lot of sugar fluctuation in the body. And there are times when, the body actually goes in catabolism. That means there is a kind of a starvation or low sugar levels, due to which the hypothalamus, that is the brain or the part of the brain which gives stimulation for secretion of hormones, that kind of goes completely out of whack and does not secrete the pulses for the correct hormonal regulation. This is almost like, an anorexia kind of a hypothalamic dysfunction, where, sometimes there are girls who don't eat at all, and then suddenly you will see that their menses stop and, they lose a lot of weight. So similarly, if you have all these sugar fluctuations and a catabolic state in your early stages of type 1 diabetes, it can lead to all this disorganized pulses being secreted from your brains and a completely disorganized hormonal milieu. And slowly, it has to be gotten back to where it was. Also, like I said, because diabetes is causing some issue at the level of the cells, they are actually affecting the cells with a low-grade inflammation because of the high sugar content. Eventually, cells in different organs undergo senescence. So these cells age much faster compared to the chronological age of the woman. So that is why the kidney function will start decreasing, the heart function will start decreasing, or for that matter, the ovarian function will also start decreasing. So this is how it is actually affecting your reproduction. In type 2 diabetes, now, like I said, what is happening in type 2 diabetes is that there is an insulin resistance. So when you have a resistance to something, so you have insulin in the body, it is trying to get into the cell and it is trying to make the cell utilize the glucose. Now, because the cell is not utilizing the glucose well, the pancreas and the body tries to push in more insulin into the circulation. This condition, something like hyperinsulinemia. Now, because of this, what we need to understand is, on one side, the sugar levels are increasing, but on the other side, the insulin levels are also increasing. And high insulin levels or hyperinsulinemia has its own problems, So when you have hyperinsulinemia, it will start affecting, the production of hormones or the androgens. Androgens are the male hormones or the precursors of the female hormones. So androgens in the body, and it will cause a higher level of the androgen or the male hormone kind of milieu in the body because of the hyperinsulinemia. And it will also cause changes in the binding of these hormones to the proteins. So if the hormones are not bound to the proteins, there is a lot of free circulation of these hormones, and then they start causing a lot of hormonal disarray in the body. Also, because insulin is like an anabolic hormone, so there are insulin like growth factors. So when there's a high level of insulin, you will also tend to start having increased chances of obesity. So all these factors kind of start combining, and again this will also affect the pulses in the brain that are going to cause the hormone production. So when you have type 2 diabetes, usually two things happen in a woman. At the level of the ovary, because of the increased the insulin resistance and the insulin-like growth factors and the androgens, male hormones, etc., you get a condition called polycystic ovarian syndrome. So there are too many follicles in the ovary, and the ovary enlarges in size, and all these follicles are kind of studded together, and the proper ovulation does not happen. So because the follicles get studded together and the hormones are not going in their proper rhythm, the proper development of the egg and the release of the egg from the ovary, something that we call ovulation, gets hampered. And therefore there are irregular cycles, there is increased hair growth on the body, there is obesity, anovulation, infertility. So this is one end of the spectrum. The other end of the spectrum is, because eventually the insulin resistance is there, but the sugar levels are also high, the cells themselves will start getting affected because of the high sugar levels, and they will undergo senescence, they will undergo apoptosis. So they will start dying, or they will start becoming ineffective, and slowly the function of the organs, then whether it is the kidneys or the eyes, the heart, or even the ovaries for that matter, will start declining. So this is how your diabetes is affecting the reproduction in females. And it has been observed that people who have high sugar levels, women who have high sugar levels, achieve menopause earlier. So which means that something is going on at the level of their ovaries. Their ovaries slowly, insidiously, not known to anybody, are slowly losing their potential to have good number of follicles, good number of oocytes. We're losing this, and the ovaries are getting aging faster and entering into menopause much earlier. In fact, it has been observed that, diabetes can reduce reproduction as much as, by 6 to 7 years. So for the same aged woman, a woman who's having diabetes would age, or her potential for reproduction would be the same as a woman who is 6 years younger to her. So she is already aged in terms of her reproductive potential. And it has also been seen that menopause can occur as early as 10 years earlier. Now, what we also need to understand is, even if we are talking about menopause and we are talking about, the ovary completely stopping functioning, it's very important to understand that before menopause, or before the ovary completely stops functioning, or really there is a large decline in the function of the ovary, many years prior to that, approximately, it is said about 13 years prior to that, the fertility starts getting affected. So which means that if the ovarian function is declining and we are detecting it now, probably the fertility has started getting affected maybe 5 years, in retrospect, or maybe 6 years in retrospect, or 7 years in retrospect. So an ovary which is just barely functioning, which is just barely making its follicles and eggs in order to give a menstruation, does not mean that the same ovary is capable of giving good oocytes which can lead to a baby. So having just regular menses does not always correlate to having good fertility. So it is very important to anticipate and understand these problems that can come forth, when diabetes is associated with a man or a woman during their reproductive age. Again, obesity becomes an independent factor for these women, because many times obesity is an independent factor that is associated with diabetes, and that becomes an additional factor which is causing an issue. So now this is the important factor. The other reason is also, like I said, diabetes has a tendency to affect our blood vessels, the microvasculature. And blood vessels are not the bigger vessels, okay? These are the small vessels that supply blood to the lining of the uterus, that supply blood to the ovary, that supply blood to our eyes, very fine vessels. And these are the vessels that start getting affected. So even before the kidneys and heart, many times what happens is that these organs where the microvasculature is important, those are the organs which will start getting affected. So very important to understand the effects of diabetes are very insidious. We will not know them. We will not know them. That, that's the reason sometimes they say that heart attacks are so frequent in diabetics, and they get missed, because when they get a heart attack, they don't even realize that there is pain sometimes, and an initial mild myocardial infarction will go unnoticed, and then suddenly there will be a bigger issue which can be catastrophic. So these are the issues that happen with diabetes, and hence it is very important to understand that diabetes can keep affecting our reproduction. And the issue is that all women are born with a set number of eggs. After birth, we cannot put in eggs into the ovary. So if you have a certain pool of eggs, we are going to keep utilizing eggs from that pool, and eventually the pool will kind of reduce, and then a woman will achieve menopause. But if for some reason the pool is decreasing faster, then there is no way. As of now, we never know where science leads us, and there are a lot of experiments and lot of materials and mechanisms that are being tried to see whether we can reactivate the ovary. But as of now, the success of this is not good enough for it to become a clinical practice, and we don't know how long that will take. And therefore, before the ovary kind of ages or the senescence occurs, it is important that the pregnancy takes place. Like I said, there are also a lot of other autoimmune issues that are associated with diabetes, and you will find that women who have diabetes also have antibodies to thyroid. They also have antibodies to ovary. So you have diabetes and you have anti-ovarian antibodies. So when you say anti, it is against the ovary, and antibodies will other cells that are going to attack the ovary. So if you have all these anti-thyroid, anti-ovarian antibodies, they're going to cause destruction of those particular organs, and therefore be an additional factor to reduce the function of these organs. So this is how diabetes affects the female reproduction. And of course, I've been talking about the ovary because it's so very important, but it affects on so many other levels. The lining of the uterus, infections setting in much earlier, which can cause damage to the tubes, which can cause damage to the lining of the uterus. So there are many, many other things that also come into play. If it is associated with obesity, the quality of the eggs that we will get after stimulation, the amount of drugs or medications that we have to use in such women is going to be much higher. So there are multiple levels at which it is going to act. I'm stressing more on the ovary because it's at least as of now, it's kind of a point of no return, because if it really causes a problem with the ovary, a low AMH, ovarian senescence, then there will be no eggs that we can get. And hence the reproduction potential or even the IVF success rates for that matter will really, really decrease. The issue is that even today, it is thought that why doesn't IVF succeed? You know, you have an egg and you take a sperm and you make an embryo and you put it into the uterus, and then if I've done everything, why does not IVF succeed? Now, research has shown that if a woman is young, and by young we mean less than 55, but I would say that's more for a Caucasian number. I would say for an Indian woman, probably 32. So if you have 6 oocytes in a young woman, then it will lead to one normal, chromosomally normal blastocyst. So to give a pregnancy and for that one embryo to be formed, we need at least 6 oocytes, at least 6 eggs. So everything does not translate 1:1. And therefore, if the numbers start decreasing, we do not get the adequate amount of eggs and we do not make the adequate amount of healthy embryos in order for that pregnancy to take place. Again, like I said, because diabetes can affect microvasculature, blood supply to the uterus, the lining or the endometrium forming well and being capable of giving good nutrition to that embryo also gets affected in diabetic women. Now let's look at the issues that it can cause in men, or the effects of diabetes on male fertility. Now the effects of diabetes on male fertility can occur at 3 levels. So we usually call it a testicular, pre-testicular, or a post-testicular. So what does it mean by a pre-testicular? It means that the testis is functioning, but something before the testis, like, the brain and there's some issue over there. So because, like I said, again, similar to what happens in women, because of high sugar levels and diabetes, there can be alterations in the hormone secretions coming from the brain, even in the men. And it can mimic something like hypogonadic, you don't have the right and the adequate, properly, what can you say, fluctuating hormones, moving hormones to lead to the right kind of effect on the testis in order to produce the sperms. So it can start affecting not at the testicular, but the enough stimulation to the testis to produce the sperms can get affected when there is diabetes. And also, like I said, because diabetes will affect microvasculature, it can affect certain cells in the testis. Like so, the Leydig cells in the testis. In the testis, there are two cells mainly. One is the cell that produces the sperms, and another one is the cell that produces the testosterone. So if you have an effect on cells that produce testosterone and there is low testosterone in the body, it will lead to erectile dysfunction. It will lead to ejaculatory problem. It will lead to a low drive for having intercourse. So all these problems will start affecting, and also the hormones or the required amount of the way the hormones function from the brain will not stimulate the testis adequately in order to make the required amount of sperms. At the testicular level, because of the high sugar levels, there will be increased amount of reactive oxidative stress. So we all know that diabetes is an inflammatory condition and there is stress. So the stress that we talk about, and the cells are also experiencing stress. We need to understand that. And during these times, there are some oxidative conditions, species that are released in the cell, which kind of actually break down the cell. If you look at a cell exposed to these ROS, then you will see that, it is all disintegrating, there's fragmentation, and it's not very good. So the ROS increases when there is diabetes. There is a problem in the sperm DNA fragmentation. So inside the head of the sperm is the DNA of the sperm. Now this DNA is not always visible when we do, is in fact never visible when we do a regular semen analysis. You have to disintegrate the head of the sperm and then look at the DNA fragmentation. So, and obviously if we disintegrate the sperm, we cannot use the sperm, during treatment cycles. But when you're trying naturally, if the sperms have a poor DNA in their head, this sperm will not, even if it does go and fertilize the egg, it will not lead to good quality embryos. And therefore, these embryos will either not implant, or after implantation, there will be a higher risk of abortion. So what happens inside the head of the sperm? In diabetic men, not just the DNA, but the mitochondria, that is, mitochondria are known as the energy houses of any cell. So it is the mitochondria in the sperm that gives the energy for the sperm to move and travel and to fertilize and to penetrate the egg. Now there is difficulty, or there are problems at the mitochondrial bioenergy function. So if there is this problem, again, the sperms will not move well, they will not be able to penetrate the egg, fertilization will not take place, there will be no embryo formation. So these are the reasons why, again, diabetes can cause problems in male fertility. Now, what are the post-testicular problems? So when you look at a semen sample, sperms are just one aspect of it. There are a lot of other glands in the male reproductive tract which are giving the required amount of fluids for this semen. Now, there is a much higher chance of these male accessory glands infections or dysfunction, due to which the semen, the volume can get affected, the semen can become very viscous, there can be continuous infection in the semen sample, which can again affect fertility of the male partner. Again, like I said, the membrane, the cell membrane, like I said, in diabetes, a lot of times it is the cell membrane. So the plasma, the cell plasma membrane also starts getting affected in men who suffer from diabetes mellitus. So these are some of the ways in which diabetes affects the females, affects the males, And it is a kind of an epidemic that is going on, especially in our country, because we are eventually going to have the highest number of diabetics in anywhere, found anywhere in the world for a particular country. And I think it is high time that we start paying attention to it. Like I said, most of the times things which start very slowly, things which start very insidiously, we don't care about it. We won't care about what's happening. And then suddenly when it becomes big, that is the time that we become aware of it, and then by then it is too late sometimes. So diabetes is not only affecting our health, it is affecting our ability to have babies, and it is affecting our ability to have healthy babies, because the higher the sugar level in the body, it is likely that it may cause an anomaly or a problem in the baby. That is why we try to regularize or keep the sugar levels as much to the normal as possible. Diabetes is also causing sexual dysfunction both in the men and the women because of the hormone irregulations. You need the right amount of hormones for a good sex drive. So the hormones are being affected. There is obesity, there is fluctuations in your sugar levels, giving rise to a lot of exhaustion and decreased desire to have intercourse. In women, there could be inadequate secretions leading to dryness, not wanting to have intercourse. So it can cause erectile dysfunction in the men. So all these problems put together, diabetes is affecting fertility in a big way. And I think it is very important for us not only to care for ourselves, but also to care for our progeny, for our descendants, for, our children who are going to, who we are wanting to bring into this world. Because I'm sure as parents, we want nothing more than the health of our children, right? We don't just want to become parents for the heck of it. We want to become parents to make sure that, we provide the best for our child. Then that preparation has to start much before we have children, and the whole reason for this interaction is to make sure that more and more people become aware of what is happening. Maybe it could be with yourself, it could be with one of your friends, it could be with one of your family members, but this is how it spreads, right? I mean, it's like they say, like, change the world one person at a time. So even if one person is enlightened, even if one person is aware, that could translate to a movement happening and leading to a much bigger change that needs to happen. So also when it comes to reproduction, now we have seen the effects. I just want to touch a little bit on, how do we treat, what should happen? Let's say diabetes is there. You can't stop everything. You can't fight autoimmunity. Even as of today, the world and the medical community does not know what autoimmunity, where it comes from and what it does. And basically it's just one way of saying, I don't know what's happening, so then we term it autoimmunity. So then there is nothing more we need to do. So obviously, if even the medical world does not know how to deal with autoimmunity, diabetes can just happen, and it may be no fault of ours. And then how do we actually manage diabetes in terms of reproduction? I'm not going to manage, go into how you manage diabetes, because that is something that a physician or a diabetologist or a heart specialist or a kidney specialist, depending on which organ is affected, will tell you. I'm going to tell you or talk about what should be the way ahead if there is an insulin resistance, or if there is a pre-diabetic or diabetic condition in the male or the female. Now, the most important thing that I want to tell everyone is, I think, a good understanding of the effects of diabetes or for that matter of any illness on reproduction. The biggest problem that I have seen in my practice is that a lot of things get missed because how each issue affects reproduction may not be something that like is each person is looking at. Like maybe your heart specialist will look at your heart function, the urologist will look at the kidney function. So in terms of reproduction, assessing and understanding and anticipating the problems that diabetes can have on reproduction comes from a good reproductive medicine unit, because the only thing we do is constantly look at what is happening to fertility and reproduction. So our eyes and our antenna are always up in terms of is anything going wrong, what is happening. So I think not missing it, anticipating these problems, not overlooking initial signs that show a decline in the ovarian or the testicular function is extremely crucial. So my real advice is go and meet a good fertility specialist. Very important, especially if there's a history of diabetes in your family, if you're a pre-diabetic, if you are obese, if you have polycystic ovaries, whatever it can be. If there is some inkling in you that there could be issues with my sugar control and I'm looking for a baby in anticipation, whenever you want to, please meet a good reproductive specialist. Why I say reproductive specialist is because as reproductive medicine specialists, we are trained to look at both females and males. As gynecologists, we focus only on females and mostly on all issues regarding birthing. So once you're pregnant and what happens, and menstrual issues and stuff like that. But reproduction is something that a reproductive medicine specialist focuses on. So anticipating the issues and having a keen eye to pick up small the telltale signs of declining function in the ovarian and the testicular function is very important. So first is please do that. Second is, I think teamwork is very important, because when there is a diabetic patient, you will need a good endocrinologist, a good reproductive medicine specialist, a good andrologist who will look after, the male factor of it, a good physician. So you need a team which can work together. Unfortunately, what has happened is, we have started recognizing our body as different parts. And I think that is something that we need to move away from. And that is why I'm such a keen, what can I say, somebody who propagates very keenly holistic medicine, because I think we are much more than different parts of our body, which we are much more than our body itself. Obviously, we all know that. But at least we are definitely much more than different parts of our body, and therefore teamwork is very important, which happens again in a good reproductive medicine unit where all the specialists come together and they can look at you as a whole, as a couple, as a problem in the body, as a problem for the reproduction, as everything. So that is very important. Also very, very important to make sure that you control your sugars well. Diet and exercise. I cannot stress the importance of these two things more. In fact, our patients will know that every Saturday, today we didn't have it because we have our FB Live, but every Saturday we have Zoom meetings for our patients which are completely free of cost. And we have 4 weeks, like 4 Saturdays. One Saturday we will have it on nutrition, another Saturday it is on yoga and exercise, third Saturday it is, one of the Saturdays it is on guided meditations, and we take Q&As on one Saturday. So now we are trying whatever little bit we can do to introduce the importance of diet, of yoga, of exercise, of meditation in our patients, and maybe, therefore their families, and, hopefully the ripple will go on, because it's not just, treating fertility or infertility for a patient. It is that health comes from a whole. It is health has originated from, something to make whole. So when you want to make yourself whole, complete, you need a lot of other things, and you can't just focus on, okay, I have this, I have that, and once my baby comes, I'm going to be happy. So we need to kind of change lifestyle, we need to change diet, we need to cut down on a lot of things. In fact, the metaphysically, when we talk about autoimmunity, like I said, in the medical world, people really don't know why autoimmunity happens, what it is, what treatments can be available. We just kind of try to suppress it down. But what is autoimmunity? It is very clear. It is when your body is acting against your own cells. So it is non-self. You're attacking your own self. So what are we doing in our day-to-day lives where we attack our own selves? Are we overstressing ourselves? Are we overworking? Are we, over competing? Are we overtly angry or jealous or resentful? Because all these emotions are not just being projected outwards, they are going to be projected inwards as well. So, in fact, I think that it is so simple to understand that autoimmunity is when we start attacking ourselves. We start attacking, we don't love ourselves, we don't give ourselves what is important to nourish our own selves. And then the body is kind of, we are attacking ourselves at multiple levels, the mind, body, soul, the whole, the human being is a component, or is a collection of all these things. So maybe as as a country which is seeing a large proportion of diabetics, we need to look at, are we really overstressing ourselves for something which really may not be as important as our health? Are we, going after competition and other things, and in turn compromising our body and our health? So I think the fight against diabetes is going to be at multiple levels, at the level of the physical, at the level of the mental or the thoughts, and at the level of the emotional. So it is important that all of us, address these issues. In terms of reproduction, again, just to end the matter, like I said, having a team is important. Secondly, having a good, because a lot of diabetics will need help for fertility, may need intrauterine insemination because the sperm quality and quantity and motility is affected, or may even need IVF for multiple reasons again. And the number of diabetics who may probably need help for fertility is going to be more compared to the number of people who do not have diabetes. Having said so, please do understand that I'm not at all trying to say that diabetics or people who have insulin resistance cannot conceive normally. You definitely can. It is all in your hands. If you completely change the lifestyle, have good control, exercise, happy, meditation, lot of things can just happen like that. But obviously there will be a quantum of people, diabetics especially, who will need fertility management and treatment in terms of either IUI or IVF. Under such circumstances, having again a unit which can cater to this in the most professional manner and proficient manner again is very important, because having a good in vitro IVF lab to make the best quality of embryos. Whenever you have anything that is decreased in amount, you need to compensate it with quality at the place where the IVF is being done. So again, those are important factors. So something that you should be doing on a personal level, and something that your doctor or your IVF center or your reproductive medicine specialist will have to take care of you. So these are the two factors that you will have to focus on, and then take the step forward. So I think to end and to culminate this talk, if a lot of us can start paying attention to our sugars and to our patterns, and knowing if we are at risk of insulin resistance or diabetes, and changing lifestyle, eating nutrient rich food, exercising, meditating, sharing, and just spending time with family and friends, and creating a happier, healthier, loving atmosphere around us, it will not decrease sugars, but it is also definitely going to increase fertility, because I truly believe that fertile thoughts go hand in hand with a lot of fertility. So it doesn't mean that we don't have fertile thoughts, but because of our own issues, our own traumas, our own experiences in the past, we are also hurt. So there are so many things we want to do, but we can't mentally do. We can't mentally overcome those issues or problems. So once we start regulating our diet, our meditation and exercise, automatically your body will start secreting the good hormones, the good chemicals, the feel-good chemicals, and a lot of things that we are otherwise unable to do, we will start becoming more and more capable of managing them. So look after your health, look after your reproduction, and I think anticipating and understanding what you must do, and who you should approach in order to fulfill your dream of parenthood is something that every couple should keep in mind. Thank you so much for joining us, and I hope that this helps everybody who listens to it. Thank you. And if there are any questions that anybody has, we can take them now. Okay, I'd also like to tell everybody who is listening is that if you have any questions later also, please feel free to put in your questions, and we'll make sure that we will reply back and give the answers to the questions that are sent to us. Also, our email ID is info@Xenith. Xenith is with an X, XENITH .clinic. So if to address on our emails, again, please feel free to write to us, and we'll make sure that we get back to you and address your questions and queries. All right. Thank you, everyone. Really appreciate everybody who joined us, and have a lovely weekend, all of you. Bye-bye.